Is it on? Okay, all right, it's on. Okay. Hello, everyone. Welcome to another session with Virtual Dental Shadows. Today, we are very fortunate to have Dr. Rascon with us. Just a reminder, the quiz link will be posted on our link tree after the session. And as usual, you're required to have 3 out of 5 answers correct to get your shadowing hours. All right, let's get started. Dr. Rascon, please feel free to take the mic when you're ready.
All right, thank you so much. First, I want to thank Virtual Dental Shadowers for having me. I think what you guys are doing is really great. It's a very different time that we're living now, and you guys are making the most of it. And I think that shows a lot of perseverance in the kind of students and future dentists you all are going to be. So continue doing what you're doing, staying on this path of always finding a way to make things work and to make sure you're constantly learning, because I think that that's what's going to serve you best. But let's go ahead and get started. So my name is Allie. I'm a first-year perio resident at the University of Pennsylvania. And basically for today, what I wanted to go over was a few things with you all. So I'll talk a little bit about myself and why I got into dentistry, and specifically periodontics, my role as a resident. I'll show you guys a couple of cases and then some final thoughts from me before we wrap up and go to questions. Okay, so I'm originally born and raised in Miami, Florida. Beautiful there. I loved it. I went to undergrad at University of Central Florida, which is in Orlando. And then I think I had my fill of Florida. So I went ahead and decided, in terms of dental school, to branch out. And I applied to a bunch, like we all tend to do. You want to make sure you give yourself the best odds. And I found that I mostly was looking for programs that, one, were in a big city, and two, that were going to have a lot of clinical experience. And then lastly, three, for me, what was very important was making sure that the dental school I went to had the reputation, if you will, to back it up. You're going to get the big names if you go to certain schools, if big names, you'll also get the right sort of support in terms of people connecting you to where you want to go. And so that was very important to me as well. And it was funny because when I was applying to all the different schools, I was kind of in a situation where thankfully I was very fortunate where I had options, but NYU actually wasn't necessarily on my radar. I didn't apply to any school saying this is definitely my number one. I had an idea of which ones I really wanted to end up in. And NYU, the idea of living in New York City was, I think, what was most appealing to me. The school itself, I only had so much background into understanding what to expect going into it. In hindsight, I wouldn't change the way I didn't think for the world. I'm very happy with my decision, and I think I had an amazing experience. But what you all are doing by listening to residents, listening to dental students, listening to everyone you can about their experiences, that's the best thing you can do for yourself. I think I kind of was just so excited at the idea of finally leaving Florida, pursuing dentistry, that I found that I would make the most of wherever I ended up. So ultimately, I have a couple of decisions to make, and then I find out that NYU comes into the mix. And I remember talking to my mom about it, thinking, should I go to the interview? I'm kind of torn. I think I already have this school in mind. And she said, Allie, at the very least, it's a weekend in New York, which is true. So I said, okay, fair enough. You're right. I go to my interview, and it was, I know this sounds cheesy, but it was just one of those things where my gut intuition told me, this is where you need to be. It was such a lively school, tons of people. It's the largest dental school in the world. And some people that might not be the most attractive option. For me personally, going to UCF, which was the second largest university in the nation, I was very much used to having class sizes of 400 or 500 people, going to school with thousands, tens of thousands. So that didn't really bother me at all. I think I almost even thrive in that sort of environment because there's just so many resources around you. There's so many brains to feed off of and ideas that I think that that's actually really helpful to have a bigger class size. So that was really cool for me to see, is walking through the school and seeing how busy the clinics were. Everyone was, they all looked a little stressed, of course, but ultimately they had a smile on their face. They were laughing. You saw everyone interacting with their friends, and it was a nice environment. And then in my interview, I got to meet with one of the deans, and she was just so personable. As big as that school is, I felt like I was truly present, and that one individual in that moment, that was all that mattered to her, was that conversation and figuring out what I want, what I think fits me best, and where I want to be. And that to me really stood out, because unfortunately, I think a lot of times you can hear people say that you don't want to feel like you're just a number. And that, that can happen in some programs. And maybe you've heard rumors that that's, the case at NYU because it's so large. I personally don't feel that way at all. I think I was very, very fortunate and lucky to go there because as large as that school was, everyone knew everyone. It was a very tight-knit family. So I'm grateful for that experience. And after talking with the dean and seeing a true day-to-day, that's what kind of sold me on making my decision to go to NYU. So did the NYU for 4 years. Again, amazing experience. I'll get a little more into what I did in my time there in a little while, but very happy with my decision. And then now bringing us up to today, I'm now a first-year resident, as I mentioned, at Penn, studying periodontics, and we'll also get into that specialty as well. I'm going to do my best to make sure when I'm talking through this that I remind myself that most of you guys listening are pre-dents, and at least if I was putting myself in your shoes back when I was a pre-dent, I didn't have much of a dental background, so I'll try to keep the terminology as basic as I can and talk through things. But please, by all means, write down questions in the chat, or at the end, please feel free to ask me anything that maybe you didn't understand or went over your head. Okay, so why dentistry? So when I went to UCF, I went in thinking I'm not quite sure what exactly I want to do, but I want to do something in the health field. I want to treat patients. I want to work with humans. I want to care for them every day. That's what makes me happy, is building those relationships and helping people. So first I joined the Pre-Professional Medical Society. And what's cool about that organization is that they offer insight into all the different background or all the different fields. So it was pre-med, pre-dental, pre-pharm, pre-vet, you name it. They had pre-everything. So that was great because we had different speakers every week from all the different backgrounds giving us their input. And so you probably think I'm going to say, this is when I realized I want to do dentistry, but it's not. I remember the dentist speaking and kind of thinking, oh, this is all right. That's okay. And I kind of just, I ignored it. I remember that I think I went to shadow an optometrist for a little while after that. And one day I'm home for like a summer break, I think. And I take my sister to the orthodontist, and I'm sitting in the waiting room, and I kind of have like an aha moment and think, Allie, you still kind of been on the fence, and you're a sophomore now. You should probably start figuring out where you're going to start, delegating your efforts most, so that you can set yourself up for success and start preparing applications, as necessary, that whole bit. So I asked my orthodontist, do you mind if I shadow you for the day? He said, yeah, of course. So I hang out with him, watching the day-to-day. It seems awesome. I mean, he's so busy, but I loved him when I was his patient. My sister loves him. His office, his staff loved him. He looks like he's having the time of his life. His office was beautiful. His lifestyle, just everything about it seemed perfect. So I told him, I think this is it. This looks awesome. And he said, okay, well, not so fast. And so this is for my point here, you see the bottom, I say the story of how I finally decided how to pursue a career in dentistry. This was how little I knew. He said, you can't just go into ortho, you need to go to dental school first. And then you decide if you want to specialize, and then you do more school. And that was a shock to me. I had absolutely no idea. I did not understand. I didn't realize the flow of how things worked in dentistry. So he said, you should go shadow your general, and then you can, decide from there how you feel about it. So sure enough, I called my general dentist, asked her if I can shadow. I had about a week left at home. She said, come on in as much as you want. So I went every day for that whole week. And each day, the more time passed, the more I saw what she was doing, the more I understood the dynamics, the more clear it became to me that this is actually exactly the kind of career that I would love to do and spend my life doing and enjoy every moment of it. I mean, it's just such a meticulous, detail-oriented career, which pretty much all of us are very type A people. So check that box. And then on top of that, again, the interactions with people, helping people every day. I love that. Unfortunately, a lot of times we meet people, and sometimes the first thing out of their mouth, they sit in the chair and they're like, oh, I hate the dentist. And, it's like, okay, great. Nice to meet you too. But even better than that is when you kind of win them over, you earn their trust, you make them value what you do as much as you value it. And I think, that cliche saying is so true. No one cares how much you know until they know how much you care. I think that we can do that in dentistry, or we're kind of forced to do that in dentistry rather, because we're already someone that people don't really necessarily want to see. And so that was to me, very rewarding to be able to build those relationships with people and be with them throughout their life, which I've always thought is really cool too. My dentist saw me and my siblings and my parents and saw us grow up. So I've always loved that aspect of it as well. Before I move on really quick here, I just to touch on the organizations themselves. Once I realized I wanted to do dentistry, then when I went back to school, I joined PDSA, which is the Pre-Dental Student Association at UCF. And I really just dove in. I took on any leadership opportunity I can. I made sure I was doing my shadowing, volunteering, helping out with whatever, possible cause that related to dentistry that I could, to really start building my resume. And similarly with PPMS, I stayed with PPMS as well. And I was directors for both those organizations. And I think that's something important to keep in mind in your applications. I can't say it enough. What you guys are doing right now is so perfect. I mean, grades are important, DAT is important, but it's not enough. You want to still remind them that you're not a robot, you're a human, and that you do have a passion for this. You're not just gonna regurgitate something on a test and get a 30 on the DAT. That's amazing, good. Like, of course, you need to be intelligent to make it through the courses in dental school. They're definitely no walk in the park. But at the end of the day, you're a human who's gonna be treating another human, and you need to have that personable aspect as well and be able to talk about it and show your passions when you're at your interviews. And I think one way of doing that is being involved. So I highly encourage you, if you're kind of just getting into it, to, even if, maybe you're more of an introvert or you've never done any sort of leadership position before, baby steps. But there's always some opportunities somewhere, even if it's not a crazy responsibility. You might be working under 2 or 3 people. That's a foot in the door. That's one way to get started and start getting used to what it's like to be more of a leader versus kind of just checking the box of I took the test and I have the grades. So going on to dental school, again, like I mentioned, NYU, it is the largest dental school in the world, but it was the best decision I could have made. I mean, I made some of lifelong friends there that I still, talk to every day, and I love them to death. They're family to me. And the faculty that I met there, I still talk to again to this day. I love them to death as well. They've really set me up for success. So at NYU, I can only speak for my experience there, but for NYU, it is a very demanding program for sure. You will not leave there not feeling like you didn't get what you were supposed to out of it, or that you're not comfortable doing something. I felt so confident, even given the pandemic right at the end there when I was graduating, knowing my skill set, being comfortable with being able to tackle, most things that someone right at dental school should be able to tackle, and then some. I felt it wasn't just that I was aware of everything I was supposed to know. I felt comfortable in treating these things and diagnosing and understanding the etiology behind it. I feel that I really got a solid background at NYU, and on top of that, the opportunities that are beyond just the clinical aspect. Didactically, I never had issues with boards. I felt very well prepared. The exams were such a pain in the butt for sure. They're very tough, but to this day, I see things in clinic and I can just spew it out because it just to me, it was like, oh my God, they ask that question on the test all the time sort of mentality. And it's funny because you do see it in real life all the time, but you don't realize how much you know until other people start pointing it out to you. And I, thankfully I get some really nice feedback at Penn now from people commenting, wow, you're just perio, or can't believe I can't believe you remember that, or that's helpful. And so it's just nice to know that I have the background. I was, again, set up for success and have the background I need to be successful. In regards to leadership, again, I personally, I love being involved, and I'm someone who's going to, if there's an organization who has some sort of opportunity available, I'm probably going to reach out and see how I can pursue it. So I stay very active, as does the American Student Dental Association. I'm sure a lot of you guys have heard of it. They even have a pre-dental chapter, but they are the largest student dental organization in the country. Basically, every school has one. Everyone has a chapter. And I was fortunate because I served as a bunch of things. I kind of climbed the ladder, but when I first got in, I was our organized dentistry liaison. So actually, as a D1, I was below the organized dentistry liaison. I was kind of just shadowing her, if you will. And then what that meant was I got to go to meetings in New York, meeting with actual dentists who are in their Dental County Society, or the New York County Dental Society, which is very common when you get out of practice to still be involved in organized dentistry, not on a student level, but as a dentist. And it's so important because if you don't have those people rooting for you and supporting and protecting the profession, we can end up in a lot of hiccups. So it's very important to remain involved with organized dentistry. And that kind of gave me insight, being able to go to these meetings and meet with these dentists and see what the day-to-day is like. And from a private practice perspective, let's say, how they can kind of balance out being involved in this way, not even while they're not being a student, running their practice, the whole nine. So that was very helpful. And then from there, the next year, D3, I became secretary. Excuse me, D2, I just misspoke. So D1, yes, I was the organized dentistry liaison. I was working alongside with someone else who had also done it. I'm sorry. D2 was secretary. And then the way that we have our system set up in NYU is that we want presidents to be set as D3, so that D4, you're the senior advisor to help make sure that everything runs smoothly in the club as people kind of move on through the totem pole. And aside from that, I was also involved with our district. So as you have a chapter, then you have your district, and then you have the national representation. So NYU falls under District 2. And so I got to serve as advocacy chair for District 2 and represent New York in that way as well. So that was really such a great experience. Aside from that, the Dental Economics Club, I think that dental schools in general, unfortunately, don't do the best job in providing that business background that a lot of us should have, because in the most literal sense, a lot of us will become small business owners, and we don't know what that entails until we have no choice but to figure it out because we now own a practice, let's say. And so what that club focused on was just the financial and business aspect of everything dentistry. And I really dove into that because my biggest motivator actually in getting involved with DEC was my student loans, because I've had to borrow every penny to pay for my education, and it's daunting. I mean, it's not cheap. I'll be candid with you all. I'm going to owe over $500,000 easily. It's a scary number. Fact of the matter is, this is just kind of the way that things are right now. It's the climate and the situation. I think that it's a broken system, and that's why being involved in things like ASDA or your local dental society is so important, because we're the ones that are advocating literally on the Hill in DC, going into offices, telling them what's happening and how we think we can rectify these issues. Kind of go off on a tangent there, but that's what kind of motivated me. Was I want to understand how to have a grasp on handling this, so that when I get out, I finally put all this time and energy into school, and I'm finally going to have an income. I'm finally going to have a job. I want to make sure that, at the end of the day, like you work so hard, your money is your money. You don't want to be spending $15,000 a month paying back loans. It's kind of sucks, to be candid. So that's what really motivated me. And in doing so, I dove in, and that's a whole lecture in itself, but I could talk to you guys all day about all your different options for repayment, staying federal versus refinancing and going private, you name it. We could definitely get into it one day if you guys would like. But point being, I thought it was very valuable to stay involved with this club. And then, same as ASDA, I kind of just climbed the totem pole there. I was secretary for a couple of years and then ultimately became president. I was also involved with our class council representing class of 2020. And I was really involved with Alumni Relations, which was so much fun because I got to keep in touch and interact with a lot of the alumni and organize all the events we had for them throughout the year. And I also did research while in dental school. I think research is something that is pretty important. I feel like, a lot of times when people are talking about applications, they tell you, grades, DAT, I guess organizations like we've been discussing and research. I do think that's true. I don't want to say that if you don't do research that your chances are gone, but it definitely gives you a leg up just because research is so important. I mean, we're going into a field that's evidence-based and constantly evolving. And so if you have any sort of insight at all, regardless of what it is, that's going to help you. For me, for example, the research I was doing in dental, in undergrad was aerospace. It was with my physics professor. Him and I hit it off, and I really enjoyed his class. And it was the coolest thing. It was this lab that was funded through NASA and all these crazy projects for something I'll never, do again. I couldn't even tell you how I even was able to run the numbers or the systems I did before. I forgot it all now. Hopefully he's not listening. But then going to dental school, I got into more of the behavioral aspect of things. And I looked at dental fear and how dental fear can affect patient retention, patient compliance, which are very important because, that's great that you can, do a beautiful 6-unit veneer case, but if the patient's not coming back, if they're too scared to come in, or in my case, if, it's great that I can place implants all over the place, but if they're too scared, that's still, it serves nothing. So that was really helpful. And then, again, something to kind of talk about when you get into your interviews and how it's relevant to your career. And now getting into my residency, I'm doing research again. Now it's definitely more catered to perio. Looking at, I didn't include a slide on it, but I'll just talk about it to you all really briefly. PRF, which is platelet-rich fibrin, which, long story short, is when you take the patient's own blood, you spin it down with a centrifuge, and then you can utilize it as to promote healing. Long story short, very long story short, we can really get into that one for sure. But that's essentially what we're doing, is looking at PRF and the different modalities that we can use it in, because it really is such an amazing tool that we have, and it's so simple because again, it's the patient's blood, and very cost effective too. So that's another good point for it. But yeah, that was my dental school experience. These are things that I got into, and again, if you guys have more questions on it, I'm happy to discuss more. I feel like I'm throwing a lot at you. I hope it's not too overwhelming, but there's, as you guys know, attend these all the time. There's a lot you can be doing. There's a lot of different avenues. This is just my story and the way that I went about things. So on that note, in terms of study tips and advice on staying motivated, time management is your absolute best friend. My friends and I would joke, there's like the triangle, the 3 triangles, and it's like sleep, study, party. It's like you can only have 2 of them. And I decided, I can sleep when I'm done. So we're gonna make the most of this, maximize your time. I was the kind of person that I'm up at 6. I'm trying to squeeze in as much as I can in my day, and by 5, 6 p.m., I start to wind down. I try to balance it out, make sure I make time for myself too, working out, spending time with friends, that sort of thing. But it all starts with how you organize your day. And it can be overwhelming because there's so many courses, and then you also have to balance lab when you're first learning how to use instruments and your drill. There's a lot to juggle, but your best friend's going to be setting time specifically in your day for what you're supposed to be doing. So if you told yourself from 6 to 8, you're going to study. If you told yourself from 6 to 8, you're going to work out. If you told yourself from 6 to 8, you're going to go to the lab, then go to the lab. But do that, because if you say, oh no, but I really should study longer, and then later on I'll push this, you just keep pushing things, and everything, it just becomes such a mess. So I think your best friend will be making sure that you are organized and setting yourself up for success by having a time frame for everything you want to get done in that day. That's what works for me. So let's talk a little bit more about perio. So what is periodontics? Periodontics is the dental specialty focusing exclusively on the inflammatory disease that destroys the gums and other supporting structures around the teeth. A periodontist is a dentist who specializes in the prevention, diagnosis, and treatment of periodontal disease and in the placement of dental implants. It's 3 years of additional training after completion of a 4-year dental program. So whoever's still awake after hearing that very boring explanation of what I do all day, you're probably asking yourself, why would you want to be a gum gardener? And if you haven't heard the term gum gardener, it's just, this funny, I guess, title that that people sometimes call a periodontist, because, the gums are our favorite thing in the world. But basically, why I value perio so much, and let me backtrack for a second. I think it's like a very well-known thing that no one likes perio when they first get into dental school, myself included. I remember the classes and thinking, this is so frustrating. It's so, the detail, the biology, there's so much science in it. It was nauseating sometimes. And then basically what changed my mind was I had a friend who decided to pursue perio, and he stayed at NYU for perio. So I would go up and bug him, ask him questions. I didn't really ever watch him work, but hearing what he was doing, I was like, oh, that sounds pretty cool. And he was him and I were on the same page, I feel like, in terms of our goals and the things that we were interested in. So I felt like he was on my same mindset. And what he said to me was the law. So I was like, okay, he's like, just look into it, give it a chance. So fair enough. I thought, let me just wait and see how the rotation goes. And I'm really lucky because NYU does a 1-week rotation in perio. So you spend the entire week every day with residents, 8 to 5. You get to see what a true life of a periodontic resident would be like. And thankfully for me, it happened very early on in D3, because that timeline lined up well with me applying to programs. basically, once I started that rotation, I started seeing all the surgery. I hadn't realized how heavily surgically based perio is. I was blown away. I couldn't believe some of the things they were doing. The cases were incredible. And it really did start to make me value perio more, because you'll find when you guys get into dental school, when you start treating patients, you know, if you're practicing dentistry correctly, ethically, the way you're supposed to, there's phases of treatment. There's phase 1, phase 2, phase 3. Phase 1 is where you're making sure everything's healthy, essentially. And what does that mean? That means prophy, which is short for prophylaxis, which is a cleaning, as we all know it. Or maybe they have periodontitis, maybe they're on the verge of becoming more periodontally compromised. Now they're going to have SRPs, which stands for scaling and root planing. Those are deep cleanings. And basically, you really shouldn't be doing any sort of dentistry, restorative work, fixed work, meaning crowns, bridges, veneers, implants, anything, any surgery. You shouldn't be doing anything to a patient until their gums are healthy. And so that's why I say sound dentistry begins with a sound periodontium, because if you want to have that beautiful case delivered but the patient brushes maybe once a day for 10 seconds and has plaque everywhere and inflamed gums, it's not going to last, and then it's going to fall on you. Now you're the one who messed up. You don't know what you're doing, versus you educated the patient, you brought them up to speed, you made sure that the gums and the tissue were very healthy. Now we can look at putting that veneer on. Now we can put the implant in. So that's what I value the most, is that without perio, you shouldn't at least be moving on with other parts of dentistry. So it makes you appreciate the supporting structures, which is what it is, which is what we focus on, is the gums and the bone. And also educating the patient, to me, is so much fun. Sometimes people, again, myself included, I didn't even know what perio was until I got into dental school. And then I got into dental school and I was like, no, I don't think I like this. Now I'm obsessed. But it's just so nice to really make someone understand why you care so much. And I think people can see that and feel that, and then it makes them appreciate what you do. I've had patients who they come in pretty banged up, and they just don't really care for their mouths. They think it's fine. Like, if the tooth has to come out one day, so be it. But on the contrary, let's keep our teeth our entire lives. We can. Plenty of people do it. Don't think that you can't, that it's normal to just lose teeth as you age. And that's what we're kind of starting to see, is more of an improvement of people valuing keeping their teeth. What do I have to do to save it, doc? How do I, what can I change? How do I improve? And it goes a long way. So I love that aspect of it. Just talking to my patients takes 2 to 5 minutes just to run them through what's going on. And again, their mindset and their attitude completely changes. In my experience, they're just so much more compliant. It's a lot more rewarding when you get to move through your treatment and see it be successful. And again, like I kind of mentioned before, the surgeries that we're doing, implants, sinus lifts, hard and soft tissue augmentations, meaning grafting procedures where we need to build up areas that maybe we don't have enough of. Soft tissue plastic surgery, so think like gummy smiles, you're doing like the gingivectomies, that sort of thing, or recession, you're getting root coverage. And resective regenerative procedures are kind of generic blanket terms. Resective would be kind of when a patient's the pockets are a bit too deep, but a deep cleaning is not quite going to cut it. So we need to start doing some recontouring and making the area more maintainable for the patient. Regenerative procedures kind of going on with the augmentation bit that I just said, where we're using grafting materials, things like that to rebuild, which is pretty amazing at knowing that we can regenerate certain sites. I think it's incredible. Those are the things about perio that get me really excited. And then one other note on perio, I guess, in terms of another reason why it made sense for me personally to pursue this was, again, being very candid with you all, I'm going to owe quite a bit of money, and a general dentist coming out does well, but on average, let's say it's between $150 and $200 that they're making, and you owe over $500,000. Your income to debt ratio should ideally be 1.5 to 1. 2 to 1 is kind of pushing it. It's not ideal. And by specializing, your income potential shoots up quite a bit. Here, let's see, on average for perio, they had 291, and this is when they did an average between 2000 and 2015. So you can imagine, just based on normal inflation rate, that number is even higher now. And so by sacrificing 3 more years, even though it's going to cost money for most programs, my program included, I am having to pay tuition. I don't have a salary right now. taking on the debt I am now still makes more sense for my income potential in 3 years. I'm setting myself up to be able to afford that comfortably, and then something, knock on wood, thankfully, so long as I get a job, and not be as stressed out as I would have if I just did general and came right out of school and had to pay back all those loans. So that was another factor for me as well to consider. Okay, so residency. It's definitely, I don't want to say I thought residency would be easy, but I guess I didn't realize it's somehow busier than dental school. And I never thought anything again in my life would be as hectic as dental school. I remember thinking, wow, we survived. This was exhausting. I think I aged 10 years in 4, and then residency started. And I said, no, who am I kidding? It was such a, I don't know. It's great. I do love it, but it was a shock because the days are very long, and every program's a little different. Everything I speak of is from my own experience, but for Penn, you have the option to pursue a master's as well. So in joining a program, and some programs are going to be more clinically based, more didactically based, more research based. It really depends. I think Penn's a pretty good mix. I feel like it's pretty equal. It's mostly clinical, but also compared to some of the, I guess, like the VA, the hospital programs, more didactically heavy too. So I still have classes for my residency program. And then on top of that, because I'm pursuing the master's, I have master's classes. And then on top of that, just like dental school, you don't show up at work one day and they say, okay, you're sitting at chair 2 and you're doing this, and that today. No, it's, here's a roster of people. You get maybe like 25 to start, and then every week you get 5 to 10, or at Penn, it's been hectic. I mean, I think I have over 100 active patients now, which is a lot. I guess compared to average from what I'm hearing. You have to call these people on your own, figure out what they need. You have to schedule them. Sometimes you have to kind of deal with the financial questions and the insurance, which we're not trained to do. So unfortunately, there's only so much I could ever help out with that part of it. And just the logistics of handling everything, staying organized, making sure you get the patients in, they're following up. It's a lot for sure. But I think at the end of the day, if you're doing something you love, then it's well worth it. For me, time and time again, every time I sit down and have a surgery, as soon as I grab the scalpel, I get this rush, this little giddiness. I feel like a little kid. I'm like, okay, this is why I'm here. This is exactly why everything is worth it. And I think if you can find something that makes you feel that way about what you're doing, and know that the good outweighs the bad, if you will, if you want to call it that, then that's what will get you through it. But residency is, it's demanding, but the whole purpose is to train you and prepare you, especially if you're going to specialize, because you become the go-to for a lot of things. There's questions that even now some of my friends ask me that went to dental school that decided to stay general. For the most part, I feel pretty comfortable answering them, but sometimes they'll ask me questions and I find myself thinking, oh, yikes, I don't know the answer to that, and I really should. And I'm going to be the person that someone's going to ask and depend on and just trust my word for it when I get out. So pressure's on. You really, if you want to do well with this, you have to know your stuff. And I think residency prepares you for that. And then lastly, it's, again, I feel like I've been very cheesy today, but you want to make the most of the experiences. You want to laugh as much as you can. I absolutely love laughing and joking around. My co-residents are awesome. My attendings are great. So we have, everyone has like their days and their moments, and sometimes it can be really like frustrating, but we're still always laughing. That clinic is a riot. I mean, you always hear someone laughing at the other end, God knows what, and it's a good time. So find a place where you feel comfortable, where you know that even though the days are going to be really hard sometimes, and maybe even just straight up suck, that you have the people around you that are going to make it worth it and make it better for you, or make the day better for you. Okay, so let's talk about an example of what a day is like for me. So I'll wake up, usually 6:30 is actually a little later. I feel like I'm probably up closer to 6, and I've been trying to do yoga every morning. I've been pretty good about it. If anyone's interested or into yoga or wants to get into it, I started with baby steps. This one's 10-minute yoga flow. Kind of been working my way up to doing a little longer, 20, maybe even 30 sometimes. But there's yoga with Adrian and yoga with Cassandra on YouTube. If you guys wanted some suggestions for starting off, they do 30-day challenges, which are awesome. After that, I go to clinic. I'm there 7:30 to 5 p.m. and it's everything we discussed. It's the being in the clinic, seeing the patients, working up cases. So I was just going off about you having to meet the patient, you having to arrange everything. On top of that, if you have a complex case, which most cases we get are complex, that's the reason why they're even being referred to a specialty clinic to begin with. You have to work up that case and you have to plan it. And, especially this day and age, implants are very common. Everyone's getting them, it seems. And there's different approaches. So you can do a traditional approach, which is analog, where you have the wax up and you have to plan this and that, or you have a digital approach that you can take as well, which is a lot of fun, but just another thing you have to learn, right? And then you have to sit with an attending, you have to talk through the case. So that takes up time as well. Also at Penn, and I think most residency programs have to have some component of this. I do teach once a week in the afternoon, so I'm with the pre-dentals, and I'm upstairs helping them with everything perio, whatever they need really. I'm doing the research like I talked about. Surgeries. So it's a mix of you're doing consults, follow-up surgeries, and then we do have class for perio specifically on Tuesday afternoons and Thursday afternoons. Excuse me. We have perio class Tuesday evenings, Wednesday afternoons, and Friday afternoons. And then I have the master's courses Monday afternoons and Thursday afternoons. So class every day, which is so much fun. Love it. Not really. Anyway, time management, again, it's so important. So you have to make sure you fit everything into your day that you need to be doing, but you also, very, very important, have to make sure you're making time for yourself, or I would be surprised if you don't go crazy. I think we all need to find our outlet. Yoga for me, maybe it's a walk for you, maybe it's reading a book, calling family, calling friends, catching up with them, whatever floats your boat, but don't skip out on giving yourself that little escape every day. Not every other day, not, oh, I'll do it to, double the time tomorrow. Every single day, make sure you're taking that moment for yourself, because that, I think, is going to keep you sane first and foremost, but also it's going to help you bring you back to why you are where you are, why you chose to do what you're doing. So can't stress that enough, you guys. Make sure you're, balancing everything. It's a tough career, but it is worth it. So you want to make sure that you keep that in check. Okay, let's talk about a case now. So a lot of times as a first year resident, what you'll see is extraction ridge preservation, which is taking the tooth out. Extractions are removing teeth. Ridge preservation is using a graft material to maintain the space if you plan to have an implant there eventually. I got very lucky because I had a case where you could put an implant right away. Those are, typically considered more complex cases, especially when they're in the aesthetic zone being one of the front teeth. So I got very, very lucky. And at this case, kind of fell in my lap, but it was a great guy. Unfortunately, he had a tooth that broke, number 7, which is the lateral incisor on your upper right. And it was deemed non-restorable, meaning it's too far gone. We can't really do much more for this tooth to keep it. You can't put a crown on it. You'll see in the photos, but it's a goner. And so plan was extraction implant placement. And after looking at the CBCT and evaluating, we saw, oh, we can do a special type of implant here, the coaxial southern implant, which is really cool because, as I'll show you in some photos, a lot of times when we place implants in the anterior zone, you need to place it in such a way that the restoring dentist can put a crown on. Ideally, this is the most ideal situation, and screw. And there's an axis on the crown where you can screw the crown on versus using cement. Because what happens is a lot of times when we're using cement to restore implants, we're seeing periimplantitis, which is inflammation because there's cement leakage. It's sitting underneath the gingiva, causes inflammation, ultimately leads to bone loss. It's a big headache. And so the way to go is what's called screw retained crowns. And that's always the goal when we're restoring, is putting the implant in a position where the dentist can have access to that access hole. So here's the first patient. So that's number 7. Again, as you guys can see here, non-restorable. I mean, you really can't do much for this guy, unfortunately. It's just broken down a bit too much. So I did what's called my chair and my director would always mess with us and say there's no such thing as an atraumatic extraction. It's minimally traumatic. He's like, no matter what, you're manipulating the tissue, you're going to cause an inflammatory infiltrate. This is just the way that process goes. So minimally traumatic is the right terminology if you're able to take a tooth out intact without really disrupting anything. So can you guys see my cursor here? Yeah, okay. So basically, this is the most ideal situation, is that all the socket walls are intact, meaning all the bone around where the tooth was is intact. and we were able to keep the tissue as is. We didn't have to elevate a flap, meaning cut open the tissue and lift it up so that we can expose bone. So that came out nicely. This is the tooth. Intact, meaning that tooth didn't break at any point when we were trying to take the tooth out. And you can confirm via blunt apex. That means that if this is something that's feeling, so to touch, you would feel over the apex here of the root, and it'd be pretty smooth and blunt. You would otherwise, if you felt something sharp, let's say, or like it's sliced, then you probably left the root tip in there. You have to go explore and find it, and hopefully it's not too much of a headache. Okay, so here's the implant. So tooth comes out and no flap elevation, meaning I was able to just work within the socket here, follow the protocol for the implant. So basically you prepare it where the implant will finish at the level subcrestal, meaning a little bit below the bone, and also a little bit below the tissue, because we want to develop this soft tissue. It's called a nice emergence profile for the crown that will go on later. Again, if any of the terminology I'm using is a bit much, talk to me about it at the end, and I'll break it down even more. But this is just kind of what things sound like in the perio world, and the more you hear it, the more it'll make sense. But anyway, back to the design of the implant. What was cool is because of the amount of bone he had limited bone, and so we had a limited space to work with in the front. And what this implant allows you to do is basically place it where you will definitely make sure that the implant is completely submerged in bone throughout, but the implant can still be restored as if it was placed where it's supposed to be placed. So when you place anterior implants, the implant, this part, if this was a normal implant, should be all the way back here, lined up with this part of the tooth, which is called the cingulum. But notice, look, the implant's way more facial, if you will. That's how we describe it. So the implant, we were able to place more facial so we can have it in the correct angle. That way it's covered in bone. But now when they put the crown on the implant, the dentist still is going to be able to have access to the screw channel right here, versus imagine if this is an implant, a normal implant I placed right here in the front of the tooth, you're probably going to see, I don't even know what, it's not going to be very pretty. You know, you're going to have a hole right here on top of the incisal edge, or maybe even showing through here some of the metal. So we don't want any of that, obviously. So what's nice is implants where we needed it, but also you can still restore the implant as if it was a regular position. So that worked out really nicely. And that's a radiograph just to confirm the placement. So this is, I don't know how much everyone knows about radiographs, but this is what we want to see. This is the height of the crest of the bone. Those are the threads. We have it subcrestal, and then we have the collar for the abutment portion. And when we restore the tooth, it's going to look much more natural in this way, because the soft tissue is going to be able to develop out here, and the crown's going to sit and look a lot more, again, natural with the rest of the arch. And then what was really nice is that he got to go home with a tooth still. It didn't, he didn't have to leave with a space missing. And I have a retractor here in this picture, so we can't really appreciate how normal this looks, but he has a low smile line, meaning when he smiles naturally, his lip is covering all this portion. So from anyone on the street, anyone that talks to him, they would have no idea, but there's actually no tooth here and an implant that's healing. So that was really great. He was able to leave with a tooth. Now on the flip side, this is the second case I want to show you guys. Sometimes we don't have enough bone. Sometimes we have some sort of defect, and unfortunately we can't do an implant at the same time. And in that case, when that happens, but we do ultimately know we want to place an implant, then we need to do GBR, which stands for guided bone regeneration. And in this case, this patient needed a tooth. Again, it was deemed non-restorable, and he had what's called periapical pathology. I'm sorry, I didn't include the radiograph, but basically, bear with me. I'm just gonna use this as an example. Pathology would be, so this whitish that you're seeing here is normal healthy bone. If you had some sort of pathology, you would have what's called a radiolucency. Lucent meaning you can see through. So this area here would be much darker. And in this patient's radiograph, we can see he had that. It seemed like he had an apico done and in a granuloma form. So what that means is he had a root canal treated on that tooth initially. Then it failed. So they went in and they approached his case by creating a flap, so lifting up the gum tissue like I talked about, and only cutting off a portion of the apex of his tooth and then letting that heal. But sometimes when you do that, you can still have what's called granulation tissue or a granuloma form, and that's just soft tissue. It's not bone, and no bone regenerates there. So that's what happened in his case. And And this is that patient. So similar to the first patient, same tooth and everything actually, which is pretty funny, but non-restorable, clearly. And this tooth is, you can kind of see there what's called the gutta percha, which is what you fill in the tooth with when you do a root canal. This was a goner. So we take the tooth out, it's intact, but we decided to take a radiograph just to confirm, and sure enough, we still saw that dark circle. So this is what it looked like after the tooth was out. Again, it was atraumatic, but imagine if this was a radiograph up here, we still see that sort of black circle around the bone. So we say, okay, well, now we have to open up and figure out what's going on. So we open up the flap. These are not where I had put them, sorry, but so these gray lines here are just showing where we made the cuts, the incisions. So we kind of cut around the gum tissue here. This was already open, obviously, because the tooth came out, cut around tissue here. And then we do what's called a vertical releasing incision. So we just cut straight down there. That way we can reflect and move this tissue back and see all the bone. And so we did so, and this is what we found. This is called a fenestration. A fenestration is when you have a portion of bone missing, but it's kind of like a window. So we still have bone more incisally and apically, right? And the socket, of course. This is one kind of defect we can see. Another is something called a dehiscence. A dehiscence is when basically even the incisal portion of this whole part of the bone would be missing. And so they, the different etiologies, they can both happen for different reasons. In his case, he had the fenestration due to the granuloma that we had removed here. I didn't have a photo of it, but basically before we took this shot, there was just a big piece of tissue. It kind of looked like, I don't even know how to explain it. Maybe like a red jelly bean or something, but not that same consistency. But anyway, so we were able to remove that, cleaned everything out, and that was the defect. So then we go ahead and we graft it. This is the bone graft. Trying to keep it as simple as possible, but there's different types of bone graft materials we can use. And so we packed all the material that we had here, and then we put a membrane over it. We need membranes to reinforce and keep the graft material we put in place, because you can imagine all this stuff here, this is all just particles. They would just run rampant. It'd be all over the place if we didn't contain it. So we have this, it's a pericardium membrane here. It's really nice to work with. It's a very satisfying picture. Me and my cousins were laughing about it, but basically we're able to tuck in on the back side here. This is called the palatal portion. And then the way we designed the flap, we could also tuck in here as well. And once we lay the flap back over, it kind of keeps everything in place. And then lastly, just for closure, closed everything up. We didn't get what's called primary closure, which is when we want all the tissue to completely shut everything out, which is fine. Sometimes you can't do that, especially if it's a extraction case like so. But we'll do crisscross suture here. You can kind of see it, and then closed up the vertical. And everything healed nicely. He's still going through the healing process now. We're going to take a CT probably in the next couple of weeks to see if we got the bone we needed to fill in, and if we did, then we can proceed with placing implant. So it was a fun case. That was one of my. This was actually my first extraction case in the clinic when I first stepped in, and I was thinking, oh, cool, quick little extraction, this will be fine. And then this happens, and I was like, oh, okay, here we go. It was a little scary, but also a lot of fun. So I'm glad I had a good experience with it. Okay, guys, so coming up on the end here, but just some final thoughts for you. I feel like I've said all this a ton throughout my presentation, but do your best to remain positive. It's going to be trying. There's going to be days where you're really frustrated, where you feel like, why did I even choose this? But you did it for a reason, because it really is such an amazing career. It's so rewarding. It's, to me, the best job you can have. You're treating people, you're making a difference in someone's life, but you're not staying up or getting called in at 3 a.m. to do it, which is really great. And take care of yourself. As I said, make sure that you're, whatever that is that makes you happy, give yourself, even if it's just 10 minutes, ideally a little more, but even if it's just 10 minutes, give yourself that time to kind of bring yourself back to peace, make yourself aware. In this moment right now, I'm really frustrated, especially now. Let me walk away. Let me go do that thing that always helps me feel better. And then last but not least, hard work does not go unnoticed. So put the time in and you will be rewarded. True words, I feel like have never been said. It's nice to kind of get that feedback, whether it be from patients or your attendings or your faculty or your friends. People notice when you care and when you're trying. So don't forget that and put the time in, and you'll be very happy, I feel, in the end. And that's it. Here's some of my contact info. Please, you're all welcome to reach out to me at any point. I'm here to help you. I'm so excited for you all and your futures. I know you're all going to do amazing things. And I hope you learned something today. I hope it wasn't, too overwhelming. If you think perio is for you, let me know. I'm happy to talk more about it with you. And that's it. Thank you, guys.
Thank you so much, Dr. Rascon. We do have some questions from the live chat. First question is, what do you think is something that sets candidates for dental school apart from others?
Sets them apart from others. I feel like if you're going to get into organizations, it would be that you find, you don't have to join 15 organizations. I think if you find one or two, but you make that your baby, if you will, and you take on some project and that your name's all over that, I think that's going to show through in your interviews, and you're going to be able to talk about it so easily because that's just what you're passionate about. For example, at UCF, we had Nighthon, which is one of those dance marathons. I thought it was the funnest thing, and the club I was in kind of participated, but it wasn't their main focus. So I kind of decided, okay, well, I'm going to be the hype man for this, and I'm going to talk about it all the time. I'm going to try to get a good team going. I'm going to make sure I blow it up. And so it made me excited, and I was able to talk about it in this way with interviewers. So in getting involved, find something that can be yours and stick with it for the however many years you have left. I think that would help set you apart.
Thank you. The other question is, why is a tooth in case study case 2 considered non-restorable?
Why is it considered similar to case 1? Because this tooth, let me open the picture. It fractured to the gingiva. And so similar to case 1, when you have teeth break down this low to the gingival margin, then second thing the other treatment option sometimes is crown lengthening, which is where you open a flap, cut away some bone, create more room for a crown to go on. But that you can only take away so much bone before you compromise the ratio, the root underneath versus the crown. And in both cases, the prognosis was poor to hopeless for either case if we tried to do crown lengthening.
The other question is, were you a bit uncomfortable looking and operating on teeth when you first started out of school?
Yeah, of course. It wasn't uncomfortable. I think it was a little nerve-wracking because, even though I spent God knows how many hours in lab, D1 and D2, that first time you see a patient, that first time you hold a drill, it's scary. It's a human. You don't want to slip, God forbid. You want to make sure they're comfortable. You're hoping you did the anesthesia correctly and adequately. But what was nice for me, I can say this confidently, is that your hand skills, when you develop that muscle memory, even though you're nervous inside, your hands they know what to do. You just spent 2 years drilling all these damn plastic teeth, hundreds of them, that the hand skills are there. It's just you just have to tell yourself to stay calm and be relaxed.
Someone asked, would you say it was easy or hard to make friends with your peers in dental school?
Very, very easy, thankfully. I think that reason being is because everyone's in the same boat, especially at being NYU. People are coming from all over the country and all over the world, and people are eager to make new friends because most people weren't from New York. So we had, it was so much fun. This was like an unofficial welcome party for D1s. Someone in our class we had a Facebook group for everyone. So everyone was on the Facebook group, meeting roommates, exchanging info or planning, meetups. And then this one student said, whoever's in town the Saturday before we start class on Monday, go to this rooftop, let's all start meeting. And I think probably 50 or more people went. So it was amazing. We all hit it off. And then Monday, sure enough, we showed up to school and it was like everyone already knew each other. So that was really nice.
Someone asked, pre-COVID, what were clinicals like in NYU? When did you start clinic?
So you mostly start clinic right at the end of D2, pretty much when you're essentially a D3. In my case, I kind of started actually a couple months earlier, and that was because I speak Spanish. And that was a big benefit because, speaking a second language in general, right, is always helpful, especially if you're in a place where that language is spoken predominantly. We had quite a few Spanish-speaking patients. So at the time, in my group specifically, there's multiple groups at NYU because of how large the class sizes are. and each group is about 25 people per class. So in my year, or in that particular year, there just weren't enough Spanish speaking students. So my director said, if you're comfortable with it, I might start giving you a couple people now. And we, so I got started maybe about 2 or 3 months before my colleagues, but we were already in there through D2 working on each other. We just didn't start getting patients until the brink of D3. And then thereafter, you have, again, you're getting patients added to your roster weekly. You're in clinic for NYU schedule Monday through Thursday for sure, and then every other Friday. And you have 4 hours of clinic time, so you basically can see anywhere from 2 to 4 patients depending on what you're doing.
Thank you. Someone asked, what is the minimum average grades that you were required to meet in order to stay in the program each year?
For dental school,
yeah,
I think it's
dental school.
I don't know. I mean, you know, just I think the whole idea for everyone was like, just don't fail. Of course, like first and foremost, if I had to put an average on it, most passing scores for classes were 70, if that's helpful. I would say, yeah, above a 70.
Okay, let's do one more question. You mentioned that you were very involved during dental school. So how did you balance or manage your time around it? What are some tips for that?
Yeah, I feel like I filled my days up. That's just how I work though. I feel that I need to have a lot going on, and that's when I become hyper focused in what I'm doing. If I have more of a relaxed day, then I feel like because I know I have more time to do this thing, I'm just kind of going to take it a little more easy. If I have a ton to do, then when I'm doing that task, I am laser focused on it. And that made me efficient with studying, made me efficient with research, made me efficient with the clubs I was involved in. And it made me really value like the free time I had if I was going to the gym or if I had dinner plans with someone to catch up. So for me, you know, again, the time management aspect of it is planning out. I mean it when I say it. I don't sit down and write down my days and say from 6 to 7 I'm doing. But in my head, I know I need to be done with this thing within this hour, or I'll give myself just 2 hours to get it done. And it just works for me when I think about it that way.
Thank you so much. I think that's all the time we have for today. And it was a really informative presentation. Just a quick reminder to our viewers, the quiz link will be in our link tree. So please take the quiz and it will be up to 24 hours. Thank you so much.
Thank you guys so much for having me. And I'm here for you all. Seriously, any questions, just reach out anytime.
Thank you.